Good evening to all. Today, our topic is basic life support. We have an eminent speaker today, Dr. Madhavi Mala, consultant anesthetist, Avitis Hospital, Palakkad. To introduce the topic, I invite our State Treasurer, Dr. Srikanth, who is also in charge of the Apex Trauma Center at Thiruvananthapuram. Welcome, Dr. Madhavi and Dr. Srikanth.
Good evening, sir.
Good evening, all. Thank you, Dr. Abhilash. Am I audible? Hello, am I audible?
Yes, sir.
Hello. Yeah. Thank you. Yeah. Good evening, all. This topic, as we all know, is a very, very important topic, uh, which every citizen in a civilized society should be aware of. It is not only important that every healthcare worker knows about it. It is also important that every citizen. Uh, Actually, we are trying to introduce this topic as part of the curriculum in all schools, the mid-level schools, so that every citizen gets a chance to know about it. The reason we all know is that we know we are receiving a lot of sudden deaths happening, and many of which are due to cardiac arrest. So, the basic life support or CPR is the first aid given to a person in cardiac arrest. The idea behind this is to maintain the circulation to the vital organs, brain and heart, until the medical help arrives for the patient is resuscitated. So, I very well know that a simple online class will not suffice uh, to train healthcare workers in this regard, but definitely this will be the first step in throwing light uh, towards such an important topic. I urge all of you taking part in this training uh, to also undergo a hands-on training at the next available opportunity. We have already supplied uh, mannequins to all districts. Must be available with your DMO. I know of 3 districts, Trivandrum, Ernakulam, and Malappuram are using these mannequins for regular trainings. I'm not, but even otherwise, every institution can buy one CPR mannequin. It is not very costly. You can buy it from your hospital funds, or even you can get somebody to sponsor it. It's not very costly, and it is a very good thing to have a mannequin in your institution so that you all get trained, regularly trained, and save a life, once you save a life, that gives a lot of joy, and it promotes your or uh, it increases your confidence in doing CPR. Let me congratulate Dr. Abhilash and team at DH Vadakanjeri. So, they have recently resuscitated two back-to-back resuscitations, and 2 people have survived. So, that should be uh, an incident which promotes confidence in which inspires most other institutions and healthcare workers to go ahead and do CPR and save more lives. So, I congratulate the academic cell for having chosen this topic. Now that AHA has come out with the recent updates, the 2025 updates. Uh,
ഞാനേ നീ
topic will
മെഷീനിട്ട് പറഞ്ഞിട്ട് ഓനോട് ഇരുത്തായിരുന്നു
the time of choosing this topic is also relevant because the updates have just recently been published. So, you'll all, those who have already been trained will also get a chance to have the new updates. So, thank you all, and wish you a good session ahead.
അതെന്നുവെച്ചാലേ അവരുടെ ഒക്കെ കണക്ക് കിട്ടിയാൽ നമുക്കൊന്ന് ഞാൻ ഇന്നിപ്പോ വലിയ പർച്ചേസാണ് 60,000 റുപ്യന്റെ പർച്ചേസ് ചെയ്യുന്നത്. അപ്പൊ അതിനനുസരിച്ചുള്ള റിട്ടേൺ വരുന്നില്ല. റിട്ടേൺ കൂടുതലും തിരൂർക്കായതുകൊണ്ടായിരിക്കാം. പക്ഷെ നമ്മളെ കെയറിന്റെ
Shall we start?
ഒരു സെക്കൻഡ്. ഡോക്ടർ ശ്രീകാന്ത് ലോഗ് ഔട്ട് ആയോ?
I am still online.
ഡോക്ടർ ശ്രീകാന്ത് എന്നെ ഒന്ന് ഹോസ്റ്റ് ആക്കാവോ? ഡോക്ടർ ശ്രീകാന്ത് എന്നെ ഒന്ന് ഹോസ്റ്റ് ആക്കാവോ? എന്നെ ഒന്ന് ഹോസ്റ്റ് ആക്കാവോ?
ഒരു സെക്കൻഡ്.
ഞാൻ ലോക്ക്ഡ് ഔട്ട് ആയി പോയായിരുന്നു.
എന്റെ അവസാനം ഭയങ്കര പ്രശ്നമാവും.
അതേഴ്സ് ഒന്ന് മ്യൂട്ട് ചെയ്യാവോ?
മന്ത്ലി കാൽക്കുലേഷൻ ഒന്നും നടക്കണില്ല.
എന്റെ ഐക്കണെ ക്ലിക്ക് ചെയ്ത് മേക്ക് ഹോസ്റ്റ് ഇട്ടാ മതി.
വരുന്നില്ല.
നാളെ രാവിലെ ഇവിടുത്തെ വള്ളിത്തുണ്ട ഇല്ല, നീ ഇതിന്റെ നോക്കിയിട്ട് അവരോട് വേണം ചോദിക്കാം.
ഓക്കെ താങ്ക് യു. അതേഴ്സ് പ്ലീസ് മ്യൂട്ട്. ഒറ്റ സെക്കൻഡ്, എല്ലാവരും ഒന്ന് മ്യൂട്ട് ചെയ്തിട്ട്. Dr. Madhavi, you can start.
Okay, sir. Yeah. Good evening, all of you. Today, I'll be talking about basic life support. Myself, Dr. Madhavi Mala. I'm working as a consultant anesthesiologist at Avitis Hospital, Nenmara. I've been given a chance to talk about this topic, basic life support, this evening. All of you are aware of it, but still I'll try and brush some salient features or important points in this basic life support. And also I'll try and update, I'll give you the updates from 2025 AHA guidelines. So let's go into this topic. What is basic life support? It is a level of medical care which is used for people experiencing life-threatening emergencies, such as cardiac arrest, respiratory arrest, or airway obstruction, until they can receive a full medical care at a hospital. So it is the first step that we do to help a person. So basically, BLS aims to maintain circulation and breathing through immediate intervention, by helping sustain life and increase the chance of survival. So today's learning objectives will be the importance of high quality CPR, describing all the steps of chain of survival, and BLS concepts of chain of survival. Like we all know, the elements in the system of care will differ based upon the situations. That is, the way we give the basic life support will differ based upon whether the victim is inside the hospital or out of hospital, or whether it is an adult or a pediatric patient. Now, what is cardiac arrest? It is an abrupt loss of heart function in a person who may or may not have been diagnosed with a heart disease. It can come on suddenly or in the wake of other symptoms. Cardiac arrest is often fatal if appropriate steps aren't taken immediately. Now, how are we going to prevent it, and how are we going to prepare to deal with such a victim? Is that we'll have to organize community CPR program to train and prepare the public. We'll have to start public awareness program training to help recognize signs of heart attack and cardiac arrest. We have to start using emergency telecommunicators who will give instructions via the phone so that the rescuer can deal with the victim easily. If you're continuously getting an instruction via phone, then it'll be easy for the rescuer to deal with the victim. Again, by start using mobile phone apps or text messages who can summon the trained members to the public, from the public, so that the trained member can reach the site where the victim is. Okay, and start using mobile mapping to locate the nearest AED. That will also help a victim, again, by means of establishing public access defibrillation program. Okay, by this program, what we are trying to do is we'll start teaching the public on to how to use a AED and all that, so that we can save many lives. A cardiac arrest has occurred. So now what are we going to do? We'll have to know about the chain of survival in order to help a victim. Okay. So according to 2020 guidelines, there were two different types of chains of survival. Okay. So in hospital chain of survival and out of hospital chain of survival. Each chain of survival, there are 6 chains. Okay. So this is the picture which is representing the out of hospital chain of survival and in hospital chain of survival. The points are, out of hospital includes activation of emergency response, giving high quality CPR, defibrillation, advanced resuscitation, post-cardiac arrest care, and recovery. For in-hospital chain of survival includes early recognition and prevention, activation of emergency response, high quality CPR, defibrillation, post-cardiac arrest care, and recovery. So this is according to 2020 guidelines. Now, in 2025 AHA guidelines, they have unified all these chains of survival into a single chain of survival. Okay, there is no separate out of hospital chain of survival or in hospital chain of survival. The steps in this chain of survival includes recognition and emergency activation, giving high quality CPR, defibrillation, advanced resuscitation, post cardiac arrest care, recovery, and survivorship. These are the 6 chain of survivals in the recent update. By using this, this can be used for adults, pediatrics, in hospital, out of hospital cardiac arrests. In this chain of survival, in today's class, I'll be discussing about the first 3 points only. That is recognition and emergency activation, giving high quality CPR and defibrillation. Okay, these 3 will be coming under BLS. The rest of the 3 will be coming under ALS actually. Now coming to BLS in detail. Today's class, I'll be stressing more upon how we give chest compression, airway management, and breathing. What are the steps of giving adult BLS? The first step is, before you give life support, is that you have to check for the scene safety. Only when the scene is safe, you will think about giving a BLS to a victim. The second thing is, you will check for the response of the victim. So how are you going to check for the response is that, if it's an adult, you will tap on his or her shoulder, okay, and call out loud, are you okay? Okay, and if you find that there is no response, then you will immediately activate emergency medical services and ask them to get an AED. If such a mishap, like an arrest has happened inside the hospital, most of our hospitals have got this code blue. We can activate code blue and we can proceed with the next step. In case if it is in a place, if the arrest happens in a place where there is no one with you to help, then you can always use your phone and ask someone to help you out in this situation. Okay. This video will show you a scenario where inside the hospital a patient becomes unresponsive. Her bystander will go and get a nurse, and how the nurse is going to respond is what you have to see. So in this video, we saw the third step. That is, the sister started assessing the pulse as well as the breath of the patient. Okay. So we should not be taking more than 10 seconds for this. Okay. So where are we going to check the pulse? It will be the carotid. First, you have to identify the trachea and glide your fingers onto the sides, into the groove between the muscle and the trachea, and locate the carotid and feel for it for not more than 10 seconds. Okay. And simultaneously, you will have to look into the breathing also. So how are you going to look into the breathing? By means of, standing in a slant position and looking for the chest raise and or abdominal movements. You will not take more than 10 seconds for these two purposes. Now coming to the first scenario. You found that the victim is having pulse as well as breathing. So what will you do? You will just monitor until the EMS arrives. Okay. Now coming to the second scenario, the patient is not breathing, but you can feel the pulse. What will you do? You will have to give rescue breaths. How many will you give? You will give 10 breaths per minute. That is, each breath will be lasting for 1 second. You will have to give one breath every 6 seconds is what I meant. Okay. Now coming to the third scenario. Third scenario, the patient is not breathing or gasping and there is no pulse. In this scenario, you will be giving a high quality CPR. Now coming to in detail, like how are you going to give a rescue breath? For giving a rescue breath, you will have to put the patients in such a manner that you can manipulate his airway. That is, how are you going to manipulate it? You will give a head tilt and a chin lift maneuver. How will you give a head tilt? With one hand, you will hold the forehead of the patient and you will push it down. With the other hand, you will lift the chin. By doing this, you will open up the airway. In case you suspect a cervical vertebral fracture, in that case, you will not manipulate his head. You will just give a jaw thrust by gliding both your hands around the angle of the mandible of the patient and just lifting it up. By doing this, you will open up the victim's airway. Okay. Now, how are you going to give a rescue breath after opening the airway? You will use a CPR mask or barrier devices. These are the pictures showing few pocket masks or the shields. These are supposed to have a one-way valve through which you will be able to deliver the breath, but the exhaled breath from the patient will not be entering you. So how are you going to place the mask onto the patient's face is that you will place it in such a way that one of your hand, that is the mask, will be resting over the bridge of the nose of the patient, and you will hold one end of the mask with the index and the thumb of one of your hand. Okay, and with the other hand of yours, the thumb of yours, you will hold the bottom edge of the mask and you will fix it firmly along the jaw and try and lift the jaw so that the airway also gets opened up simultaneously. By doing this, you will be establishing a tight seal around the mouth and the nose. And after establishing a tight seal, you can deliver the breath like how you see in this picture. While delivering breath, you have to give it really well so that there is an adequate chest rise of the patient. Our exhaled air will contain about 17% of oxygen, and this can provide the victim with much needed oxygen. In case such an arrest has happened inside a hospital, then we can always use a bag and mask or an ambu bag. And when you are using an ambu bag, you have to hold the mask in a C and E technique. That is, the index and the thumb of your left hand will be resting over the mask, and you will press the mask over the patient's face. And with the rest of your fingers, you will be holding around the bony margins to lift the jaw and open up the airway. With your right hand, you can squeeze the bag and deliver the tidal volume that is required. And if the bag and mask has got a reservoir bag and if it is connected to an oxygen source, you can deliver up to 100% of oxygen. If you are having another rescuer along with you to help out the victim, then one of you will be holding the mask tightly onto the patient's face. Make sure that you're not obstructing the patient's airway. The other person will be holding the bag and will be squeezing to deliver the breath. In case you get a victim who has got a tracheostomy, then how are you going to deliver breath to such a victim? Is that in case you are having a pocket mask, you can always keep a pocket mask on top of the tracheostomy port and try and blow through it. In case that is not effective, you try to close the nose and mouth of the victim and try to blow through it. Even by that, if you're not able to establish adequate breath, you can, if you are having a bag and mask, you can directly connect it to the port and you try to give breath through that. Now coming to the fourth point, the fourth step in the BLS, that is high quality CPR. So for giving high quality CPR, we'll have to place the victim on a flat, firm surface, and you have to stand by the side of the victim. And you have to keep the victim's head, neck, and torso in line. Provider should also position their hands and body accordingly to give an effective chest compression. So how we be going to keep our hands is that we'll keep heel of one of our hand over the other and on the lower half of the sternum of the victim, and we will lock it. And the provider must also straighten their arms and position their shoulders in line with their hands. I'll show you the picture. So this is how you will have to stand next to the victim for giving a chest compression. This is it. This is the way you will have to lock your hands to give effective compression. This is on the lower half of the sternum. So what do you mean by high quality CPR? It is nothing but putting the patient on a hard surface and by giving a compression which is push hard and push fast is the term that is used at a rate of 100 to 120 per minute at a depth of 5 to 6 centimeter, that is 2 to 2.4 inches in an adult. And you have to allow adequate complete chest recoil, and you have to minimize interruptions to less than 10 seconds, use of early defibrillation, and by giving effective breaths with adequate chest rise. All these are included under high quality CPR. This video will show you how to give an effective CPR. So this is how you have to give chest compression. Make sure that you are not flexing your elbows and your elbows are locked. Okay. So what is going to happen when you are giving chest compression? Okay. What is going to happen when you're giving chest compression? So by compressing the heart during CPR, this procedure will pump the blood from the heart to the brain and then to the rest of the body. Once you interrupt it, it will take several compressions to bring back the blood flow to a level before interruptions. So the longer the interruptions are, the lower will be the blood supply to the brain and other critical organs. So that is why under high quality CPR, we will say that you have to minimize the interruptions to less than 10 seconds. Now coming to what is chest compression fraction. The proportion of the time that rescuers perform chest compression during CPR is what is called chest compression fraction. Ideally, it should be at least 60 and up to 80. Okay, so by establishing this, we can get a ROS, we can attain ROS easily, and the rate of survival of the victim will be very high. So ideally what they're trying to say is we have to minimize interruptions and we have to give quality compression continuously without any stop. Now, how are we going to give CPR in a pregnant woman? The steps that I mentioned before will be the same, except one particular step where you will have to do a left uterine displacement. This will be one extra step that you have to follow. Okay. This is what is called manual lateral uterine displacement. By doing this, we are relieving the pressure over the large blood vessels in the abdomen. Okay, so this especially holds good for patients who is more than 20 weeks pregnant. Now coming to two rescuer CPR. What are the advantages of having another rescuer along with you while giving CPR? Is that one can concentrate on the compression, the other will concentrate on the breath. Okay, and also they can switch among their roles when needed. They can switch every 2 minutes or after 5 cycles, or when the AED is prompting them to switch, or sooner if fatigued. By having another rescuer along with you, the quality of CPR will also be good. So this video will show you how you give CPR when you have another rescuer along with you. So the second rescuer has arrived. He is taking care of the pets. When you are having two rescuers, make sure that you do not collide with each other. So while switching the roles, make sure that you do not collide with each other. Now, what do you mean by CPR coach? CPR coach is nothing but a trained person who is trained to train other resuscitation team to deliver high quality CPR. Okay, so a coach usually points out the mistakes while we do our CPR, and they will help to correct us and give a best result. So what is the role of a CPR coach? They coordinate the start of the CPR. They coach to improve the quality of compressions, and they will state the target compression rate. Like if they feel that the rate of compression is actually decreasing, then they will try and alert us about it. And also the ventilation volume. Like if we forget to look into the chest rise, they will look into it and they will alert us. And also they will watch throughout the procedure. Okay, they will help to minimize interruptions also. Now coming to the fifth point, we got an AED. So as soon as the AED arrives, what should we do is that we have to put it next to the patient, like shown in the picture, and without disturbing the person who is giving compression, we'll have to stick the pads onto the patient's chest. And where we'll have to stick will be given on the surface of the pads. We'll have to just follow the instructions. Some AEDs, as soon as we open, it'll get open the box, it'll get switched on. The others will have a manual button to switch on. And once the pads are attached, you will have to make it analyze the rhythm. And once it analyzes the rhythm, it will order us to stay clear, and it will deliver the shock if it's a shockable rhythm. Soon after the shock is delivered, we'll have to resume the CPR immediately. And only after 2 minutes will the AED prompt us about the next rhythm check. So this process of continuing CPR and AED usage will be going on until an ALS provider arrives. Once the ALS provider arrives, he will take care of the victim. Now coming to what is this AED or automated external defibrillator? It is basically a lightweight portable computerized device that can identify an abnormal heart rhythm, which is mostly PVT, that is pulseless ventricular tachycardia or ventricular fibrillation, which needs a shock. So by giving a shock, what it does is that it will set the abnormal rhythm into normal. And by setting the rhythm to normal, what we get is we get an effective circulation so that the victim's heart will start pumping the blood and we can feel the pulse. That is, the ROS can be attained early. Coming to public access defibrillation program. So why is this program basically? It is basically to train the lay people on to how to use a AED pads that is available. So basically such kind of programs is to be conducted in places where there are large number of people, like office buildings, airports, convention centers, casinos, and schools. Another thing we have to stress upon is that how are we going to maintain the AED and its supply? Somebody should be always designated to take care of it at different localities. So we'll have to check the person who is taking care of it should take a note about its battery, the order and replace supplies, including the AED pads, adult and pediatric pads, and replace the used equipment, including barrier devices like pocket masks, gloves, razors, and scissors. So in this video, I'll be showing you as to how to use a AED while giving compression and breath. Here, two persons are giving compression and respiration. The third person gets an AED. They switch on the AED and they're following the commands. Here you can see that the person applying the pad is not disturbing the person giving compression. So soon after the shock is administered, they are resuming the CPR. Another thing that you have to remember is that when the AED is analyzing the rhythm, you should not give the chest compression. You have to stay aside and wait for further instructions that is coming out from AED. Now coming to special circumstances, you get to see a victim who's having hairy chest or a wet chest, or who's having implanted defibrillator or a pacemaker, or who's having transdermal medication patch, or a pregnant woman with all the fetal monitors who's in arrest, and or somebody who's wearing lots of jewelry or a bulky clothing. So in such situations, how are you going to place the AED pads? In the first scenario, a person with a hairy chest, in case you have a razor with you, you try and remove it and then stick onto a bare skin. And if you don't have a razor, but if you have an extra pads with you, you can just stick on the pads onto the, as described by the AED pad location, stick it onto the proper location and try to pull it out so that the hair also comes along with it. Then use the second set of pads for giving the shock. When it comes to a wet chest, you have to dry mop it and then only stick the pads onto the chest. A person with an implanted defibrillator or a pacemaker or a medication patch, make sure that the paddles are not touching that. Okay, you can place it anteroposteriorly when it comes to a defibrillator pacemaker patient. Okay, and in a patient who's pregnant and who's having fetal monitors, you try and remove the fetal monitors and only then place an AED pads and deliver shock, because this fetal monitors can also, they say that it will interfere with the delivery of the shock. And in a person who's wearing a lot of jewelry, make sure that the pads are not touching the jewels. And with the bulky clothing, you try and remove the clothing from the location where the pads are to be stuck. Okay. Now, this is the 2025 algorithm for the lay rescuers as to how to deal with a patient with in arrest. Okay, so the first step is that you find a person who's unresponsive, who's not breathing, or who's having abnormal breathing or gasping. You will immediately activate the emergency response and get an AED, and you will start the CPR. And once the AED arrives, you will apply the pads and follow the AED prompts, and you will resume CPR for 2 minutes. This cycle will go on until the EMS arrives. So this is the algorithm 2025 for a lay rescuer CPR. This is the algorithm 2025 for an adult basic life support in a healthcare professional. Okay, so here first thing that you have to see is the scene safety. Then you will look for the response and you will shout for help. If there is no response, you will activate EMS and ask them to get an AED. Then the next thing that you do is, like I said before, you look for the breathing and the pulse. If the pulse and breathing are normal, you will just monitor them. If the patient is not having if the patient is having abnormal breathing, but the pulse is felt, you will just assist them with the breaths alone. You will be giving 1 breath every 6 seconds or 10 breaths per minute, and you will be checking the pulse every 2 minutes, and you will give the in case if you suspect that the patient is having opioid overdose and that is why this abnormal breathing has happened, you should be giving naloxone. This administration of naloxone is emphasized in 2025 updates, and they have told that naloxone should be made available everywhere so that they can give promptly to the patient whom they suspect to be having an opioid toxicity. Now, the third scenario, if the patient is not breathing or only gasping, and the pulse is not felt, you will have to start CPR immediately. That is 30 compression is to 2 breaths till the AED arrives, and you will have to follow the AED prompts like I demonstrated before. If it is a shockable rhythm, then the AED will be delivering shock, and then you will resume CPR. This cycle will go on until an ALS provider arrives. Now, coming to what is team dynamics. Team dynamics is nothing but the people who are giving this BLS should be aware about their roles and responsibilities. Like certain people will be having some limitations. They'll not be knowing everything, right? So they will have to admit that they know only this much and they don't know certain things. And in this, by doing this way, we'll be able to give an effective intervention for the, we'll be able to save a life by admitting our flaws. Okay, next thing is communication. So by communicating between the team members, what happens is that we can share our knowledge, we can summarize the entire scenario, and we can reevaluate where we are, and we'll always have to use a closed loop communication, okay, when we are giving resuscitation. And also we should be giving clear messages, and we should be respecting each other, okay. Debriefing. After this resuscitation attempt, we have to do a debriefing, which is must in team dynamics. A debriefing includes how the resuscitation went and why they took certain actions during resuscitation, and whether anything can be improved, and to provide emotional support to the team members. Yes, somebody was asking me, can they give CPR in a gasping patient? Of course, they have to give CPR in a gasping patient immediately without any delay. This is a picture which is showing the team dynamics, okay, in a BLS provider, among the BLS team, okay. So this will include 3 points. One is airway, the other one is compressor point, and the other one is AED monitor, okay. There should be coordination between these three, only then there will be an effective CPR. Now coming to the next point, which is pediatric BLS. Pediatric BLS is more or less the same like an adult BLS, except there are certain changes which I'll be highlighting now. The first point, like always, is verify the scene safety. Second is check for the response and get help. Third one is assessing the breathing and pulse. Now, you find that the child or an infant is having a normal breath and the pulse is also felt. In that case, you will put the baby or a child in a recovery position and you will monitor till the EMS arrives. Okay. Second scenario, you find that the baby is not breathing, but there is a pulse. In that case, you will give rescue breath every 2 to 3 seconds. That is 20 to 30 breaths per minute. Okay. And you will also be assessing pulse simultaneously every 10 seconds. Now you suddenly realize that the baby is having a heart rate less than 60 and the baby is turning blue. In that case, you will start CPR immediately. Okay. If the heart rate is greater than 60, it is better to stick on with the rescue breaths alone. So in the case of an infant, where are we going to check the pulse? It will be the brachial pulse, which is between the elbow and the shoulder on the inside of the upper arm, medially. Okay. And in the case of a child, you can check their carotid or their femoral between the pubic bone and the hip joint. Next point, you have witnessed a child and I mean there is an unwitnessed collapse of a child that you have noted. So what will you do first? You will immediately start CPR. Okay, before even calling out a EMS, you will first start a CPR and you will give CPR for 2 minutes, and only then you will activate an EMS and ask them to get an AED. Okay, as soon as the AED is available, you will follow the commands as told by the AED. Okay, and you can give shock if advised by the AED and resume CPR and AED until the ALS team arrives. Now, the compression method in the case of a child or an infant, okay? So, if there is only a single rescuer, you will be giving 30 compression is to 2 breaths, okay? And if you have 2 rescuers, you'll be giving 15 is to 2. That is 15 compression followed by 2 breaths, okay? Why is this, Now, the depth of compression will be around 1/3 of the AP diameter. That is around 4 centimeter in a case of an infant and 5 centimeter in a case of a child. Okay. And technique of giving compression can be 1 or 2 hands. By using 1 or 2 hands, you can give compression in a case of a child. And in the case of an infant, you can use 2-finger or 2-thumb encircling method as per 2020 guidelines. Okay. But according to 2025 guidelines, this 2-finger usage is no longer advised. They are asking us to use only 2-thumb encircling technique to give a compression for an infant. Okay, they say that is more effective than 2-finger method. Okay, the reason for changing is this. Another thing is, if you are feeling that the 2-thumb encircling method is not giving adequate compression, then you can always use 1-hand heel method and you can give chest compression. Where will you give chest compression? It will be at the center of the chest or below the nipple line. You have to allow adequate chest recoil, okay? And you have to minimize interruptions. Now coming to where will you place the AED paddles in the case of a pediatric case? You have to place it anteroposteriorly. If you find that the child is big enough, you can place it like how you place it on an adult, but make sure that the pads are not touching each other. Okay. In case you don't have a pediatric pads, you can always use an adult pads on the pediatric cases. But in case you have an attenuator along with it, use it so that the dose of the shock can be reduced if needed. By giving an adult dose, it is not going to cause any harm though. So this is how you place the AED pads in an infant. This is the 2025 algorithm of a pediatric basic life support with a single rescuer. It's the same. Like how I said, you have to first verify the scene safety and look for the response, shout for the help if there is no response, activate EMS and look for the pulse and breathing. If it is normal, you will just monitor. If there is no breathing but the pulse is felt, you will be giving rescue breaths, 1 breath every 2 to 3 seconds, a total of 20 to 30 breaths per minute. You will be assessing pulse simultaneously after 2 minutes. And if you find that the pulse is normal, you will just continue giving rescue breaths. Okay, if you find that the pulse is also decreasing, heart rate is going down, you will start giving you will be giving CPR for that person. If you are a single rescuer, you will be giving 30:2. And if the second rescuer arrives, you will start giving 15:2. Okay. And as soon as the AED arrives, you'll be giving shock. And if you suspect opioid overdose, you can give naloxone. As per 2025, it should be available everywhere and should be given as early as possible. And after once the AED tells you that a shock has to be given, you'll be following the AED commands till the ALS provider arrives. This is another algorithm with 2 rescuers for a pediatric basic life support. This is the summary of all the points that I've been saying so far. Summary of high quality CPR components for basic life support. Now coming to special circumstances. Choking. The patient is mild choking or it can be severe. Choking, the person will be continuously coughing and the person will be having wheeze. Okay, if it's a severe choking, then the person will be clutching onto the throat. He or she will not be able to speak or cry. There will be poor air exchange and not be able to cough. They'll be having high-pitched noise and no noise while inhaling, and there could be possible cyanosis. So this picture demonstrates how a person who is choking and who has a severe obstruction will look like. Okay. Now coming to the person is choking and he is responding. So what will be the first step that you do? You will have to give 5 back blows followed by 5 abdominal thrusts. Okay. Five abdominal thrusts. So the abdominal thrust is what is called Heimlich maneuver. So according to 2025 guidelines, giving 5 back blows followed by 5 abdominal thrusts is very good. They say that back blows actually helps in dislodging the foreign body from the throat more effectively than an abdominal thrust. So in this video, they'll show you how to give an abdominal thrust in a child. This is the same in a case of an adult also. Okay, so in this video, they have told you how to make a fist. Okay, so you will make a fist with one hand and you will be keeping it between the umbilicus and the breastbone. So the exact location will be just below the breastbone is where you have to keep the fist, and you have to hold it with the other hand. You will push it upwards and backwards. Okay, so by doing that, there will be adequate pressure for the foreign body to get dislodged from the throat. So what if the person who is choking is a pregnant lady? There you will not be able to give an abdominal thrust. Instead, you should be giving a chest thrust. Okay, so here you will be placing the arms under her armpits and around her chest, and then you will be giving the thrusts in a backward and upward direction. Now, the choking person suddenly becomes unresponsive. Then what will you be doing? Here, you should not be doing chest thrust or abdominal thrust. Here, you should be calling out for help and place that person on the ground, and you will start the CPR. When it's time to give rescue breaths, you will have to look into their mouth to find if the object has come outside. Okay, and you will be repeating the 5 cycles of CPR and or 2 minutes and activate EMS if not already done. This is the algorithm showing adult foreign body airway obstruction. Here, like I said before, you have to look for the scene safety and look for the signs of severe foreign body airway obstruction. If there are signs of severe obstruction, if there are no signs of severe obstruction, then you will just encourage them to cough out the foreign body that is causing obstruction. In case it is they are showing signs of severe obstruction, then you will activate EMS. Okay, and if the person is responsive, then you will be giving 5 back blows and abdominal thrusts. If the person is not responsive, you will be giving CPR. This is an algorithm showing foreign body airway obstruction in the case of a child. It is the same as in the adult. Now, choking in a case of an infant. How will you deal with it? Here, you will be giving back slaps and chest thrusts, and you will have to hold the infant in as shown in the picture. This video will demonstrate how to hold them and how to give a back slap and chest thrust. One, two. So this is how you hold the baby with your forearms and by resting the forearm onto your lap. Okay. And this is the kind of support that you give when the child is responsive. If the infant becomes unresponsive, then you will have to start CPR and activate EMS after 2 minutes if not already done. And never do a blind finger sweep inside the mouth, because such kind of an activity can actually push the foreign body deep inside the throat. This algorithm will demonstrate how to deal with an infant with a foreign body airway obstruction. Okay, this is same as that of the adult and the child algorithm that I showed before, except that you will have to give back blows and 5 chest thrusts. Now coming to opioid emergencies. Okay, opioid emergencies is according to 2025 guidelines. They say that naloxone should be made available everywhere, so that whenever you suspect a person with an opioid toxicity, you'll have to administer it early is what they're saying. So this algorithm is actually 2020 algorithm. I didn't get in 2025 algorithm yet. So here you can see that you have suspected an opioid poisoning. First thing that you have to do is check to see if the person is responding, and you will shout for nearby help, and you will activate the EMS and get the naloxone and an AED. Check if the person is breathing. If the person is breathing, you will make sure that he is not going to deteriorate further. How will you do it? Is that you will continuously tap the person and you will shout and call the person to be awake, and you will reposition him and consider giving naloxone and continue the same action until the EMS arrives. Okay. In case you find out that the person is not having proper breathing or stopped breathing, in that case, you should start CPR immediately. Okay. Also, you will have to give naloxone simultaneously. So this, that is the algorithm onto the left is an opioid associated emergency for lay responder algorithm. And onto the right, you can see healthcare providers algorithm. The difference here is that the person who is giving naloxone and who is taking care of the victim who is in opioid toxicity will be checking the pulse also. Then the previous algorithm, they did not check the pulse. In this algorithm on the right, they are checking the pulse, and if they find out that there is no pulse, they will start the CPR and they will start using AED as and when needed. Now I'll be talking about few 2025 BLS changes. Like I said before, there is only a single chain of survival now. That can be used for adult, pediatric, in hospital and out of hospital setting. And this is a consolidated version of a single, 6 chain of survival. Certain changes in the terminologies are brought about in 2025. Those include breaths is the term that are used rather than rescue breaths as before. In 2025 guidelines, you will see that they would have used this term rescue breaths everywhere. But in 2025, they are using only breaths. And they have reserved the term ventilation for those breaths, those assisted breaths that are given using bag and mask or an advanced airway. So whenever you are giving a breath using a bag and mask or an advanced airway, it is always called ventilation. Okay. When you are giving a breath using a face mask, it is called, or a face shield or a pocket mask, like I told before, that is called as a breath. Lay rescuer is a term that is used in the recent algorithms rather than lay person or lay responders or bystanders. Okay. And a ROC and a ROSC differences have been mentioned in 2025. A ROC is something when a return of circulation after CPR is achieved by mechanical means like ECMO usage, and the term ROC is used. And when the return of spontaneous circulation is due to recovery of cardiac function without mechanical intervention, ROSC is used. Now, recommendations advise the implementation of public policies that permit the use of naloxone in cases of suspected opioid overdose, community initiatives to promote lay rescuer response to out-of-hospital cardiac arrest, telecommunicator recognition and instructions have been emphasized, elimination of two-finger compression and use of two-thumb encircling or heel of one hand for compression has been emphasized, and the use of back blows is now recommended as the initial step for conscious adult or child with a foreign body airway obstruction, followed by abdominal thrusts. And providing breaths by using a pocket mask has been shown to deliver more effective breaths than using a face shield. So a pocket mask should be used if available and deliver each breath until there is a visible chest rise. At present, the routine use of mechanical CPR devices is not recommended, but may be considered in special circumstances in which high quality CPR cannot be maintained or when the healthcare professional safety is at risk, such as during transport of the patient to a hospital. Okay, in that case, in those scenarios, we can use a mechanical CPR devices, which can continuously give CPR. Okay, and immediate and delayed debriefing for system improvement, that is for the team improvement, for effective team improvement, debriefing is an important thing. EMS system should be prepared to perform termination of resuscitation on scene. This involves EMS professionals receiving training on death notification. That is, here what they're trying to say is that, like, there will be certain instances where the victim who had been receiving this CPR from the lay rescuers wouldn't have shown any signs of ROSC at all for quite a long time. Okay, maybe the EMS team would have arrived really late, or the rescuers wouldn't have used AED at all for quite some time. So in that cases, rather than maybe the EMS professionals would feel that shifting such a patient or giving more rescue attempts or showing more rescue attempts on such a patient is going to be futile. In such cases, it is okay to declare death. For that, they should be trained for such a kind of, for work. And feedback devices for lay rescuers, major effect on the CPR quality. Okay, and rapid cycle deliberate practice. This is nothing but a simulation program. This is basically done to improve our workplace CPR performances. You have to focus on CPR education without disparities among different populations, including school children who are less than 12 years of age, because this would enhance their interest on saving lives. And so this will be really good. This is what 2025 guideline says. So this is a short class about BLS. I think I have touched upon all the important points. Thank you for patiently listening.
Thank you, Dr. Madhavi. Now, participants can unmute and ask questions or type in your doubts and queries to the chat box. There is one question that is about Dr. Niju. What is about CPR and vasovagal syncope?
Sorry?
The question is in the CPR and vasovagal syncope.
Okay.
Question is not clear.
I think vasovagal syncope is something where the patient suddenly develops bradycardia and just goes into collapses, right? In any case where you see a person is not responding and has just fallen down, you will have to first look into their response, and you have to just follow the BLS steps. Okay, just check the pulse and breathing, and if the person is breathing and has a feeble pulse, then what best can you do is that if it is inside the hospital setting, maybe you will have to start the ALS steps. That is, you will have to give atropine if it's a bradycardia that you have noted, and if the patient is having volume deficiencies, you'll have to start giving fluids. Okay, if that is the scenario inside a hospital setting. But if it's outside and if the patient is not responding, maybe you should just start giving CPR. About the naloxone doses, I'm not really sure, but when I was going through the notes, I just got to know that when you can give up to 0.4 milligram, and even at the 0.4 milligram dose of naloxone, a few people have shown to have developed a laryngospasm. I don't know why. What's the relation between those two? And certain people have also developed aspiration and all that because of naloxone. So this is what I have noted. I don't know about the exact doses. Maybe if somebody knows, they can tell us.
Participants can unmute and ask questions directly, or else you can type doubts in the chat box.
Like I said before, in the literature, I didn't get to see whether it should be given IV or IM, nor in the algorithm they have mentioned it whether it is IV or IM. But if it is naloxone, by the way, and but if you can establish, if it's a trained rescuer who can establish an IV, and if there is a facility, maybe you should go for an IV, is what I personally feel. Though I didn't get to see in the literature where and how exactly it should be given and what should be the dose and all. I didn't get to see it, but if somebody knows, they can please share with us now. Yes, compression only life support, that is calls, is something where we give continuous compression and we will not be focusing upon breaths in this kind of in calls. Here, what they say is circulation is more important than respiration. So by establishing circulation, we can attain ROSC is what they're saying. This also includes 5 cycles. You should be giving continuous compression here, 100 to 120 at a rate of 100 to 120 per minute.
Participants questions direct ആയിട്ട് ചോദിക്കാം കേട്ടോ. മടിച്ചു നിൽക്കണ്ട, തീർച്ചയായിട്ടും ചോദിക്കാം.
This calls is basically good for untrained bystanders or those who are unwilling or unable to give mouth-to-mouth breath. Okay.
Another question is there. Conditions only bag and mask use, no compressions needed. Hello.
Conditions where only bag and mask is used and no compressions is needed, maybe in scenarios where the patient is not breathing adequately but has got adequate pulse, like in case of opioid toxicity, if the patient is not maintaining adequate oxygenation or if it's not taking adequate breaths, maybe you should just stick on to bag and mask ventilation if you're inside a hospital setup. And continue to monitor the pulse every 2 minutes because anytime they can collapse. And try and find out why the person is not breathing adequately and try to correct the root cause.
Another question is whether intracardiac adrenaline is given nowadays.
I'm not really sure about that, sir.
Not recommended.
I think they've already, this intracardiac adrenaline, they've stopped it long back. Maybe 2010 guidelines. That was the last time I think they've mentioned. After that, they've stopped it.
One of the usual mistakes we usually do is in hospitals is we don't use the CPR board before starting the compressions.
That is one main
another
thing.
question.
If we are not using a CPR board, the compression is not going to be effective. So it is just going to be futile. So always keep the patient on a firm, flat surface.
Usually
when the rescuer is hesitant to give rescue breaths, in that case, you can just continue with compression only CPR. That is more than enough.
The principle is the exhaled breath also has 17% oxygen. Is that right?
Exhaled air
has 17% O2. The compression without a rescue breath. The principle of compression only CPR.
I didn't get you, sir.
Is there any logic behind the compression only CPR without giving breath?
Oh, okay. Without giving rescue breaths, the chest compression can circulate the oxygen that is already present in the blood. That's the idea.
That's what I thought.
Yeah. During the it'll be useful only for first few minutes. That's it.
Yeah.
That will be enough to keep the brain and heart alive for some time.
Usually, another mistakes we make is when the patient comes, uh, instead of checking the carotid pulse and starting the CPR, we try to take ECG to see the. That's one of the other cost.
That's a mistake.
Is there any further questions, or otherwise we can wind up the questions? Another question is there. Will rescue breath be effective if a thin cloth is kept over the mouth of patient?
It is actually a thin cloth is not going to give you. It is not going to be an effective barrier, but if the rescuer is willing to proceed like that, they can actually proceed. There is a risk of getting contamination from the victim. That is one point that you have to keep in mind. But yeah, it is effective. A thin cloth should, I hope, should be able to allow the air that is coming out from your mouth into the victim. So that is the only thing that you'll have to take care of. Make sure of. Maybe. Yeah, loosening light clothing always is missed, like tight blouse and undergarments in females. Yeah, that is one important point that we'll have to look into. Make sure that those are loosened.
If there is no further questions, we can wind up the session. And today we had an excellent session by Dr. Madhavi Mala, and she has updated us about the 2025 guidelines. I thank you, thank Dr. Madhavi in the name of our KGMOA academic cell for agreeing to take the class and
Thank you, sir.
updating us on this topic. Thank you once more. Thank you, Dr. Madhavi.
Thank you. Thank you so much, sir.
Thank you.
Thank you all.
Thank you.